increases your endurance.
You can get your enhanced at Southwell VA4, Restorer Pharmacy Soufre, Knights Med Miku, Lay by Bar The Morn, Dexter's Place Jeremy Street Castries, Citygate Bar The CDC opposite the market, Clans Place Denry Highway, Arlette Supermarket Soufre, The Release Stress Bar Labrie Highway, Cool Joint Bar Victoria Schwazel, Prios Bus Stop 22 next to the Moshi Bus Stop opposite the Grosile Bus Stop, Prios Bar and Grill in Corinth Grosile.
Enhance, the best a man can get.
Good morning all, and welcome to another episode of Public Health Insider. I am your host, communications specialist attached to the Universal Health Coverage Unit and the St. Jude Hospital Reconstruction Project. I am Jade Brown. Today I have with me the project officer over at Universal Health Coverage. His name is Josue Prevelis.
Good morning, Jade, and good morning, MBCs and Real FM listeners.
Yes, okay, fantastic. Thank you so much for joining us today. And it is a very, very special day indeed. We are, can I say, celebrating 1 year since the launch of Universal Health Coverage, right?
Yes, we are. We are actually 1st of June just gone. We're celebrating now our anniversary since we've launched the 1st June of 2023. And now we are about to say what has been happening so far.
Oh, fantastic. Now, I know it's been an exciting year, but before we get into it, I would like for our viewers, just bring them back to the 1st of June 2023 when we launched over at Constitution Park. Of course, Prime Minister, the Honorable Philip J. Pierre, was in attendance, and this is what he had to say.
Now, if you can't afford it, you will not mind, you will not care with those who can't afford it. But we care about those who can't afford it. And this is why we are doing it here today, to ensure that those who cannot afford it, they get the opportunity to get the basics, the prenatal care that they need so they can have healthy babies. So what's happening here this morning is a significant step. It's significant, it's revolutionary. You're going to be focused on the people, and we're going to ensure that after, when we've left that scene, at least we can say that under this government, the people were better off.
There you have it. Under this government, the people were better off. And I know so far we had so many wins with Universal Health Coverage, what with the maternal and child health launch of that as well. And I mean, the minister, the Honorable Moses Jabatis, he was present at the launch. Of course, he is the Minister for Health, Wellness and Elderly Affairs. Let's take a listen to what he had to say back then.
I went to cabinet and said, what are we going to do? We are not waiting for all of the information on financing. We are not waiting for all of the experts to tell us exactly what to do, because if we do that, it's going to be election time and we would not have delivered anything under universal health coverage. So we said we are moving step by step, phase by phase, delivering to the people, and as we move along, improve the healthcare services, improve the quality of infrastructure, improve efficiency so that we can implement universal health coverage as we move along. And that is exactly what we are doing.
The government of St. Lucia, through the Ministry of Health, Wellness and Elderly Affairs, is launching universal health coverage phase 1 and maternal and child health services.
You wanted to introduce it step by step. Is that what has happened?
And the step-by-step has been definitely correct, and this is where we call it maternal child services, which is the first step. And I believe one of the research, our Minister of Health, he has addressed it correctly when he mentioned the maternal and child services to take care of the mothers, because there was a research conducted, delivered in 2023 by Aaron O'Neill, where he speaks of the high infant mortality rate in St. Lucia, where it considers 2021 with the highest peak of infant mortality in St. Lucia. And by having healthy mother, as a Minister for Health said, Honorable Moses Matis, by having healthy mothers, it ensures us that we will have healthy babies.
Okay.
And healthy babies means also healthy nations, which is very important. And that's what we have been focusing on since we have started with Mother and Child Services.
Okay. Okay. So that would have been part of phase 1.
Correct.
You have it? Okay, fantastic. Now, of course, spearheading universal health coverage would be our director, and I like to call her the incomparable Dr. Alicia Eugene Ford.
Yeah.
At the launch of universal health coverage, Dr. Alicia Eugene Ford delivered an impassioned address, not just to our esteemed guests, but we had it at Constitution Park, so you'd find that many people who would be going on their daily, routes would have stopped, listened, engaged. And of course, we streamed live on, I think it was NBC television at that point. This is what Dr. Eugene had to say. So let's take a listen and then we'll discuss thereafter.
The government of St. Lucia, through the Ministry of Health, Wellness and Elderly Affairs, is launching universal health coverage, phase 1, and maternal and child health services falls within this phase. This is a great achievement. It was only about a quarter of a century ago, more than 500,000 of women globally died every year due to childbirth. Additionally, 12 million children perished before the age of 5, mainly from preventable causes. Over the past years, there have been growing concerns over the increase in our infant mortality rate in St. Lucia. Infant mortality rate is also associated with the health status of the mother and is often an indicator of how well the health system in a country is performing. Though there have been marked improvements over the years, there is still room for improvement. Universal health coverage will allow this improvement. Women are currently able to access maternal and child health services at our primary healthcare centers with no out-of-cost spending. However, laboratory and ultrasound services, which are essential in monitoring the well-being of both mother and infant, were not offered. These services had to be paid for by the pregnant mothers or their families. Today, this will no longer be a challenge for our pregnant women. They will have access to improved antenatal and postnatal care, alongside accessibility to laboratory and ultrasound services through the wellness centers. We will continue to improve the health system pillars to attain universal health coverage. The Ministry of Health, Wellness and Elderly Affairs will continue to empower our frontline health workers, giving them the autonomy and the resources to develop strategies to improve service delivery to the women and other patients. Universal health coverage will improve our health management information system to ensure data collection analysis, leading to a results-oriented approach. This will enable our health system to be decisive, innovative, efficient, and accountable in delivering quality and accessible, affordable healthcare services under universal health coverage. Let us remember that the journey is ongoing, and there are many other services within the essential package of health services to be implemented under universal health coverage, as we offer affordable, accessible, equitable, and quality healthcare that our populations deserve.
There you have it, affordable, accessible, equitable, and quality healthcare. I think that's the ethos that we work with and we stand by when we think of UHC. So let's delve a little deeper into the year and see what are some of the gains that we've witnessed throughout the year for universal health coverage.
Thank you, Jade. Of course, we've started in the midst of 2023. Pregnancy is not something you can count per week. It's not something you can see progress of what you're doing, even over 3 months. So even let's consider, if we were to consider 3 months into our launch, anybody who delivers at that time, we can't really consider them being receiving the service, the full spectrum of service, quality healthcare, and ensuring that the babies are being monitored properly as we offer under universal health coverage. So therefore it will require some time, even at our epidemiology unit at Ministry of Health. It requires them at least a full year before they can provide the number of births in St. Lucia. Although they might give you provisional numbers, they will have that in the database, but final figures will be available at the end of each year. It is the same for us, though. We rely on them now to get the data. It's something might sound very common when the population is seeing or speaking. We speak of data numbers, how many.
Right.
But at Universal Health Coverage and under UHC, we also look in very close to the quality of the service that we offer. Because in order for us to meet the standard, to meet the goals that we set out under Universal Health Coverage, which is reducing the infant mortality deaths in the country, so it requires as well to do an in-depth evaluation of the quality of the services we're offering. How many babies have received the prenatal care, and how many pregnant women were catch with syphilis on time, and there was a transmission between mother and child. So all of that, when we reduce that, we ensure that the babies will be born healthy and in a proper condition, where we'll have a less burden on the primary healthcare. Now you will not have mothers coming with babies to healthcare, with babies looking for attention, looking for medical attention, because we will have catch it earlier or during the pregnancy. Now into our year now, I'm very happy when I speak that year anniversary, and our data so far. Soon we will be talking of the quality. We'll be looking at doing an in-depth analysis of the data we have now, to stop talking about the figures, and instead of rather we'll be talking of the quality of what we will providing now. We are looking at developing our KPI, which is a key performance indicators for maternal and child health services, which will also be the same for each service we will deliver, will launch under universal health coverage. The key performance indicators now, what they allow us to do is to measure what we are doing. It's not only we've seen 500 pregnant women. It's not only we've provided 100 ultrasounds, but it also how many pregnant women have received the quality health care as a pregnant woman, and all the routine lab tests required as a pregnant woman to receive. So soon, when we complete, we're in the process of finalizing our key performance indicators for maternal and child services. Once that is ready, we will come back again to talk about those key performance indicators and how we measure maternal and child services, how successful, or I will not say the contrary, but I'm looking forward for it to be successful, how successful we are in what we are doing, offering to the population. The data we have seen now, from June to March of this year, June 2023 and March of this year, 2024, we have offered lab services to 1,375 pregnant women on island.
All right.
I will not compare that data with the 1,619 deliveries we had last year, 2023, because of how we started and when we started in the midst of the year we started. So that data, we just give the data compare from the time we started to March, because we provide status report quarterly. And the last quarter we closed was March of this year. And for ultrasound services, we've provided over 1,317 ultrasound for pregnant women on island. Remember those numbers. I have to clarify something for you, Jade, and for the public. Under universal health coverage, a pregnant woman has access to 3 ultrasounds during the pregnancy.
Okay.
When I give you that number and I say 1,317 ultrasound, you can multiply it by 3.
Okay.
I will not dare to do that. The reason why, when we started in June 1st, we had a big amount of pregnant women we've received, but those they did not come at the inception.
Right.
So they come either at the time of delivery, or maybe in the second trimester, or maybe at the end when they reach their first trimester and then jumping to the second trimester where they only require 2 or only 1.
Okay.
So now we do not have an accurate figure of each to say each pregnant woman have received completely 3 ultrasounds. So then we will not go into the having a multitude figure by assuming that all 1,317 have received their 3 ultrasounds.
But the 1,317, they're individuals who have accessed the care.
Correct.
So what you're saying is, since the inception of UHC till now, you have assisted till March.
Yeah.
I apologize. So from the 1st of June to March 2024, we have assisted 1,300 plus women to access that care. And I think that's an important one, because many people, I am part of an island-wide group, and one individual was asking about maternal and child health services, and he said, well, he went to the hospital and it's not free. The service is not free because I went to the hospital and I had to pay. And then somebody in the group, and I think that speaks to our successes in terms of our PR. Someone in the group explained to him, well, no, you get the service at no cost at the wellness centers around the island. So that I thought that we should touch on that as well, because there are still people who might be confused as to where they can access, and I find that a lot of the dads have that confusion, because the fathers don't tend to. Some of them, not all. I don't want to ban everybody, but many of the men don't focus a lot.
I focus.
I think you're one of the exceptions. But in terms of the mothers, they would have that information, they would know. But then with a father, if he has to bring the mother to the hospital, they say, okay, well, I'll just go to the hospital to do the ultrasound. But in order to get access to the service at no cost to you, the expectant mother, or to your partner, the expectant mother, you must access your wellness center. So what we like to advise people to do is to call your nearest wellness center, set an appointment. If you are not registered in Sluis, if you're not registered in Sluis, then you would be registered. You would be called in by the nurse on the clinic day, and then you'd be assessed. And that's how the process goes from there. It was very important, I remember, for Dr. Eugene to clarify that and to stress on that people give the wellness center a call, because there are specific days for the service. Yes, and I do have that artwork. We will be sharing again. I think it's always important to share the information, because sometimes people would forget what day is for the clinic, and it is important to remember the various clinic days that are important to you, because with universal health coverage, as we have explained, it is being rolled out in a phased approach.
That's correct.
Through primary health facilities. So if we now introduce, for example, the cervical screening, that would be on another clinic day. So it is important to always pay attention to our pages, pay attention to the show when we come into the communities and do the sensitization drives. Pay attention to what we are saying to you, because that is important information for your health care.
Correct. Well, I believe you have reminded the population of everything when it comes to how to access the service. And I am glad that you bring that up, because I stopped thinking about it because I have not received any feedback on these challenges anymore. But it's good, the fact that you're in the field as well in terms of doing PR, and now you understand, you have met that experience as well, where people will be, okay, I go and I didn't get it, or those from the private physician, they just decide and then just walk to the wellness center, they said, I come to get the voucher. But it does not happen that way. even though you have your private physician, we leave the opportunity open to you to receive the service with the condition you have to be assessed by the midwife or the nurse to be registered.
Yes.
And for us at the Ministry of Health to have a record of you as a patient and as a national and of your situation, whether you're good or bad, whatever is going on with you, at least we have a data. For our minister to make a policy decision, he needs data. He needs data to convince cabinet on any policy decision he wants to make.
Right.
Therefore, if you come to the wellness center, we just issue the voucher. We have no accountability of what's happening and about you, about any other people. How then he can request for more for us? He can't. So he needs the data. The data is very important. So when we ask you to come to the wellness center, even though you can afford your private physician, it's not to know your business. It is still a place where you are at home. It's a health center. It contains people with qualification hired by the Ministry of Health based on their qualification experience to offer a health service. So then when you come, you will receive the same service. The difference might be the high-tech sophisticated machine that the person might have that the health center do not have. That might be the difference. But they both are qualified to assess your pregnancy and tell you what is going on and advise you accordingly and refer you accordingly as well.
Okay, that's fantastic. So we also, with universal health coverage, not only did we launch maternal and child health services where you can access your lab services at no cost, as well as your ultrasounds for expectant mothers at no cost to you, the client. We also conducted a logo and naming competition. Now, the logo and naming competition took place late last year. We had various individuals involved from, many walks of life. We wanted to open the competition to St. Lucians, for St. Lucians, because universal health coverage is indeed for St. Lucians. It was important to us to ensure that the prize was hefty as well, and we saw a winner emerge by the name of Desmond Etienne, who had won $6,000 to design and name universal health coverage. Yes. That's a beautiful prize indeed. So that was one of the other activities, but there has been a lot more going on with universal health coverage within the communities as well. So what's about the sensitization drives? I know that you've embarked on several of them with the team. Tell us how important it is to go into the communities to speak to people on a community level.
So far, we have been very strategic with the community sensitization. When we go places where there's no TV, where there's no radio, which is the fish. It can be the fish market. Last time we went to canneries. Ancillary. Thank you. We went to Ancillary. We went at the fishing market. That's where we went to do the sensitization. Where in that environment, the people are focusing on the business and the daily activities. So you don't see anybody with a radio. We on Facebook on doing such things where we post those things. So going to them now it's critical, because now you bring the information to them. Allow them to ask a question, and they also have some pertinent questions, relevant questions as well. Yes, I would say. That's why we always try in the unit to ensure that we prepare ourselves before we go out. What type of questions might be arise, and what type of response will be required at the time. Because when you go and you're not answering the questions, the people will remain frustrated. Because the curiosity, you're not open up to the curiosity. They need to know, and they don't know where they will see you again. So that kind of aspect, I see you now, I'm taking the opportunity to ask that questions for those people have not seen yet to come for that reason. And it is important that for us to know the responses of those questions, anticipate to them. We don't know the questions, but we know most of the time it will be financing.
Yes.
It will be taxes. It will be how long it's there for. Is it? I know you guys have a habit of starting this. I have had a lot on when I go on ground. How long is it there, Mr. Provost? I know you guys started a few things and stop, job. How long this one is there for? People need to know those responses. There are answers required to those. It's very important for them as well, because if you don't tell them, how will they know? Because the lack or the low visit we have at the wellness centers is because the people do not know the service is free to them at the wellness centers. And that, I don't know if we can touch it on that later on, if we have time for that. But the low uptick we have in our health centers is because most of the population are not aware that the service is free to them at the wellness centers, already free. That's why we call it the maternal and child service. We added additional services.
Yes.
That means there has been other services free to them already at the wellness centers, but they are not aware of it. And we are not unique in that sense. Barbados is the same, Bahamas is the same, and Jamaica is the same. The people are not aware that at the health center, the service is free to them. So when we, in all our ads, the public will see additional services.
Right.
So it's not really a complete new, brand new. So we added extra services onto what has been already there for the pregnant.
And it is important as well to ensure that people are aware of it, because then you would have less of a burden on our main hospitals.
Correct.
As well. If you can access the care and you have that same level of care at the wellness centers, then you need not venture onto the hospitals unless in an emergency situation. But for everyday care, for example, maternal and child health, you can access the wellness center. Our next sensitization drive, as we speak of it, will be held at Jacmel. So for everybody who is a member of that community or surrounding communities, I know you have Nigel, are you from Jacmel?
Larry.
The sensitization drive, Nigel, is in it's in Jacmel this time around. So we will have to tell Dr. Eugene that Nigel is making a request to have a sensitization drive in
La Claire.
In La Claire. Okay. Wow. Okay.
But La Claire, actually, as you're in La Claire, sorry, Jade. La Claire, I have good news for La Claire.
Yes.
We have seen an increase in our data in La Claire, from La Claire. And I made not, there are many reasons that made that happen, because I know region 8A, which is Cashews in La Claire, they have always been doing community sensitization. They are always in the community. We have seen big numbers coming out of La Claire, and this is good for us in the sense that, when I say good, we did not have those big numbers coming out of La Claire when we first started. So therefore now we are seeing big numbers coming out of La Claire. I believe it is good for us. I think
it's really, really hilarious that Jacmel is
that's
very
good.
far away from, I just have to say, viewers, Jacmel is really far away from La Claire. So I'm just wondering why you're so excited, unless there's something else in Jacmel that would. So we would look forward to seeing Nigel at the sensitization drive in Jacmel for sure. And
on the 20th.
On the 20th. The facilitator, okay, yes. So as you can see, the facilitator is Dr. Alicia Eugene Ford. The entire team will be there. Yes, to answer all your questions, and it begins at 6 p.m. This is being facilitated or organized between the Ministry of Health, our Universal Health Coverage Unit as well as Equity, and the STO for that area would be Miss Marla Gustav. Lyncha Antoine, apologize. Miss Lyncha Antoine is the one organizing. So we, from 6 p.m. on Thursday, the 20th of June, we will be at Jack Mill. So if you are from Derando, if you're from Moncizo, if you're from Vanna, Mondor, you name it, you can come over to Jack Mill for that sensitization drive. We will have so much information for you, and universal health coverage is not just about pregnant women, not just about expectant mothers. It is also about those people who are seeking care for hypertension and diabetes, because PBF, the pilot project, one of our previous guests, I think from 2 weeks ago, would have been Mr. Naim Jabatis, who's also the director of that PBF pilot project, which also forms part of universal health coverage in St. Lucia. We also know, as we close, we're looking forward to new services or advanced services with cervical screening, as well as snake bite. That's an important one as well. Yeah, and I anticipate that we'll be back in Jack Mill and these areas, because you'd find that Techime, these areas, you'd have a higher population of the fedelas. So snake bite is something that's really important to us. You know that so many people lose their lives to it, so it would be coming under universal health coverage, as well as we've been speaking about it for months now. That would be the new features as pertains to screening, cervical screening, or as you would call it, the pap smear. So before we close, Josue, could you please tell us, what would you like to leave with our viewers? There's still some people who are a little skeptical about how we're rolling out, but maybe speak to the importance of the phased approach, and just from your perspective as the project officer, what would you like our viewers to know?
Thank you, Jade. It's very important that for the population to understand, we cannot come up with universal health coverage and offer a service as the name says it. First of all, finance is very important when it comes to universal health coverage. No big countries in the world have ever fully successful with implementing universal health coverage. Last week, a team from Ministry of Health went to Washington for a Caribbean Health Forum, financing health forum. We learned that from Jamaica, who had launched universal health coverage, remove all fees for services on island. Now they're about to withdraw it because it kept costing money, more money, and now the budget for health now per year for Jamaica is in the billions or the billion Jamaican dollars. It's coming from million to billion now. So now they're looking at how unfair it will be to your population of St. Lucia to offer universal health coverage with all the basket of services, and then now find out later on we cannot finance this, we cannot pay for it, then we have to take it back from you. We don't want to do it that way. So we want to move with certainty. The certainties are the maternity health services. That's what we are certain about we can offer you now.
You're right.
The next one is cervical cancer and HPV testing. That's what we are certain we can offer you. We're about to launch it now. Some internal arrangement needs to be done now, and we have cabinet memo to come out from the cabinet of ministers. So once those things come back to us, these are things we're certain to give unto the population. And the snake bite management, these are the things as well we are certain that we can provide right now. So it's piece by piece. It has to come piece by piece as we are certain of the decisions. Then we move ahead instead of just giving you the full spectrum of the service and then find out later on, nope, that was an error, so we have to take it back. So I know the population will be upset. I will be upset if you give me
and then you take it back.
Take it back from me. So now, it's necessary that we move on a phased approach by learning from the other mistakes other island countries have made for us to make the difference.
Okay, fantastic. Thank you so much, Josue, for joining us again for Universal Health Coverage. I do look forward to speaking to you throughout the year, and hopefully we can celebrate a second anniversary of UHC, and we would have seen even more gains, more people being and accessing the care. As you indicated, over 1,300 women since we launched last year have benefited from the services under maternal and child health. We have cervical screening coming up, HPV testing coming up, and snakebite coming up as well. Stick with a Public Health Insider. Next week we will be discussing the St. Jude Hospital reconstruction project. Thank you for joining us.
It is well known that diseases like diabetes, high blood pressure, and other illnesses may restrict blood flow, which can lead to impotence and erectile dysfunction. This is why Enhance was formulated to meet these challenging health problems, which can reduce your ability to perform. If you're having problems maintaining your manhood, then reclaim your manhood today with Enhance. Enhance increases your energy level, boosts your stamina, and increases your endurance.
You can get your Enhance at Southwell VA4, Restorer Pharmacy Soufre, Knights Med Miku, Lay by Bar The Morn, Dexter's Place Jeremy Street Castries, Citygate Bar The City opposite the market, Plants Place Denry Highway, Arlette Supermarket Soufre, The Release Stress Bar Labrie Highway, Cool